is a huge honor for me today to be podcast interviewing Dr. Ellie Phillips all the way from Austin, Texas. How are you doing today?
I'm really well, thank you. Beautiful day here.
I've been a big fan of yours for a long time. Let me read your bio. Dr. Phillips' passion is to empower children and adults to enjoy ultimate oral health and avoid unnecessary dental treatments. Tooth decay and gum disease are preventable and can be reversed with early detection, adequate home care, and good health education. Mouth health impacts general health. If we prevent transfer of oral disease, will this limit chronic health conditions that often appear to afflict generations of some family? You're the author of Kiss Your Dentist Goodbye, founder and CEO of Zellies, Inc., private practice as a dentist in the United Kingdom, Switzerland, and the United States, faculty at U of R, Pediatric, Special Needs Care, and Geriatric Specialties. Where's that U of R?
University of Rochester in New York.
In New York.
Mm-hmm.
So you're a member of the Academy of Biometric Dentistry, American Dental Association Evidence-Based Champion, American Academy of Pediatric Dentists, founding member, American Academy for Oral Systemic Health, Texas Dental Association, National Dental Practice-Based Research Network, member of the International Association of Dental Research, and honorary member of the Eastman Kodak, London, UK. You're an amazing woman. You really are.
I've been doing it a long time. I think some of those memberships have probably expired now because I have actually just retired from private practice. My passion is educating the public. And I think that it has been necessary to actually sort of translate what's happened in dentistry to the public, because so much has changed. And I think the public still believe in old-fashioned stuff. And I think the public deserves the right to know how much control they have over their mouth health. That's my take. That's my philosophy. That's what I do. My book gives you the impression I'm against dentists, which obviously I'm not. I think dentistry is an amazing profession, and I think today we know it actually probably can save us, if good dentistry can save us from chronic inflammatory conditions as we get older. So I believe dentistry is the center of the universe, but not if we ignore the disease. And if you look at the posts that I've made on your various forums, it's been mainly in hygiene, because I have more to say amongst hygienists than I do to many dentists who have abdicated, I believe, a little bit that whole thing of prevention. And I'm not sure that it's happening properly in sync with treatment right now. That's the concern I have for dentistry, that too much is being done, actually fixing and filling, without addressing the underlying disease.
You know why I'm not a member of all those associations you're a member of? Because I wouldn't join any association that would accept me as a member.
What does that mean?
I have very high standards, and if you accept me, then you must accept anyone.
Yeah.
Well, and a lot of it's because the incentives are wrong. I mean, like, look at hospitals. They make $100,000 if they do a bypass, a mastectomy, or cancer segmentation, and they wouldn't get a penny if they tried to talk to you on how to prevent this disease. The incentives are so misaligned.
This is why I'm excited to talk to you, because I have no power. I'm actually I may have a lot of qualifications and over 40 years of being a dentist, and actually my biggest joy is that I have a background in science before I became a dentist. So I have a very deep understanding of the disease, but what good does it do you when nobody wants to listen to you? There's no financial incentive to listen to me. There's, in fact, more financial incentive not to listen to me. I mean, people took my book title and assumed I was a horrible person without even looking at the cover. U.S. Surgeon General Richard Carmona, who did the review of the oral health of America, actually read my book and gave me some really nice accolades. But I didn't write the book for dentists because I knew they wouldn't read it. I wrote it for people who care about their teeth, people who are sick and tired of following the advice they're given by their beautiful health professionals whom they mostly adore, and they don't understand why their teeth keep falling apart. Well, it's an ongoing progressive disease, and it's not being addressed as such.
Well, there was a study on Facebook that something like 80% of articles that are shared they never even clicked the link to open to read the article. So they saw the headline, they liked the title, so they shared it with all their friends, and they didn't read one word of what they just shared, which gives it a third-party endorsement because their friends are thinking, oh, this must be a good article because Ellie shared it. And then it turned out that Ellie never even read it 4 out of 5 times. But I mean, look at orthodontists. We got 10,000 orthodontists in America putting, 322 million people's babies through this orthodontic manufacturing plant because they get $6,500 to do it. But they never talk about the fact that 400 years ago, there's never been any malocclusions found because back then babies were breastfeeding for years and eating, vegetables and fruits and having to masticate.
Absolutely.
And now you hear these American women, and I've seen them. I mean, I've been around the sun 54 times. You hear people say, well, are you nursing? No, she was having trouble nursing. So I switched to a bottle and a sippy cup. Now the baby just lays there guzzling milk, eating applesauce out of a jar. And it's like, well, no one's educating that. Yeah, that baby needs to be having difficulty and using effort and stimulating all its muscles and bones.
Worse than that, I mean, the whole thing of knowledge is so compounded. There are dentists telling women not to breastfeed, actually, dentists, because they're worried that the breast milk is going to actually damage the teeth. When I was at the University of Rochester, I was on the way to doing a thesis about that. I never actually finished it, but I got a garage full of papers. And it's misunderstood. Breast milk is not really carcinogenic. It has sugars in it that can feed harmful bacteria. But if you don't have harmful bacteria in your mouth, you're not going to get caries from breastfeeding a baby. So, I have actually taken all this knowledge that we have and spent decades, 30 years, distilling it. I was educated in London, in University of London, where there were some of the best icons in the science of dentistry that were my teachers. Today, John Featherstone, for example, Dean of UCSF. He's a mega star in America, but he was doing the research back then in the 60s. Edwina Kidd was another person. There was a guy, Dr. Tenkate. Lots of these Europeans were frantically looking back in the 60s for a cure to dental disease. And they actually even knew that mouth health was linked to body health. I knew my family, I'm British, okay? I didn't inherit good teeth. I am so grateful for what I know because otherwise I'd be right where they were. My father had all his teeth taken out when he was 35. And then my mom, she was 45 when she was told to have all her teeth taken out. Periodontal disease, we know now, but they were just getting loose. Loss of teeth is associated with dementia. Guess what? My family has early onset dementia history throughout the generations. They all had dentures by the time they were 45. So I told my mother, don't have your teeth taken out. I have a system for cleaning them. We got my mom on this system, and she just recently died 50 years later, still with not all her teeth, but a number of teeth in her mouth. And although her mind wasn't perfect, she didn't eat well either, but she didn't have the early onset dementia that the rest of the family, the complete cuckoo nuts of my aunts and great aunts. So I do believe I will take some credit that I think I saved my mother by saving more than 9 teeth because we have these studies to show less than 9 teeth associated with dementia. But do the public know this? Have they ever heard it? Absolutely not.
Well, the dentists are, humans are complex, and, the majority of dentists, if you start saying that you're natural or holistic or whatever, they just think you're a kook. But when you talk to them one-on-one, when they get a disease, when they get high blood pressure, they don't want to take a pill. They want to change their diet and exercise. When they get high cholesterol, they don't want to take a statin. They want to change. So when you look at dentists, they're all natural and holistic. And what I don't like about the disease people is that, they're so quick to say that all these natural alternatives might work. But then you say, well, what exactly causes this disease? And they say, I don't know. So it's like, okay, so you don't know exactly what causes Alzheimer's, but you're the first one to say that it couldn't be related to gum disease. You know what I mean?
Well, and that's why I simply went back with all the teaching that I had had in Europe. I actually had a wonderful first job in what would be called today a holistic dental office in Switzerland.
So you are a kook then. You're a quack.
I totally, and I mean, just to tell you, I mean, this is 1970 in Switzerland. I was the main extractor of teeth in the office because the Swiss don't know how to take out teeth because they generally prevent the disease. They don't snack all day. They were eating as healthy. I mean, their grocery stores were like Whole Foods today, 1970 in Lausanne, Geneva, Switzerland. And so I was the main taker out of teeth because I had been very well trained in England, which is where mostly teeth were just extracted, all day, every day we used to extract teeth. But before I did an extraction, the practice protocol in Switzerland was to give patients fresh pineapple and organic yogurt for a week before and a week after the extraction. I do what I'm told because I'm the new girl in the office. And I was pretty careful with my extractions. I learned to do very atraumatic extractions with elevators, so I think that was part of it. But patients healed so quickly, it was incredible. So years later, I came to America, and you're absolutely right about this, get away from me, you and your holistic stuff. I don't want to hear about it. I told this couple in upstate New York, I was at the University of Rochester, about this pineapple yogurt thing. This was 1990s, before the internet. Well, they came back to visit me after the internet I forget, when did all that happen? I think for most of us about 2000, something like that, maybe a little before. And they told me, gosh, that fresh pineapple thing is amazing. Our patients heal so quickly. So I began looking on the internet. What is it about fresh pineapple and what is it about yogurt that could possibly speed healing? I'll let you do that research if you want. You go to Dole.com, Dole pineapples, and type in, they have a nutrition institute, type in post-op pineapple. And you will find...
Will you send me that link? Go to Dole.
Dole.com.
Dole.com.
Nutrition Institute.
Nutrition Institute.
There's a part of the website. And then post-op pineapple.
Post-op pineapple.
Yeah. And of course, the yogurt was probiotic bacteria, which is very helpful for establishing a healthy, mouth for healing after the extraction. And when you see what's in pineapple, I don't know if you have it yet, but you will quickly discover that inside the fibers of pineapple is, can I tell you? Spoiler alert.
Sure.
Bromelain, vitamin A, K, C, which wasn't even discovered in the 1970s. And it's now used by a lot of, dermatologists and people involved in skin healing for skin and bone healing. And that's just one example of these so-called things that became almost like old wives' tales that there is science behind. It was the beginning of me sort of going through the threads. What and why? Why do teeth decay? Why do children grow up with early childhood caries? And what can we do to prevent it? And one day I woke up about 30 years ago knowing that I could stop tooth decay and reverse cavities and reverse gum disease if people would work with me and use the products that I recommend. And they're not all organic pineapples. Some of them are Crest cavity protection toothpaste and Listerine and Act fluoride mouth rinse. So I have sort of people on both sides of the aisle thinking I'm the kook nut because the traditional people don't want to hear this alternative stuff, which is part of the healing. And the health nuts don't want to use anything that contains fluoride, even topically applied to the outside of their teeth in a very dilute fluoride mouth rinse. And that you spit out. They won't use it because it's got the word fluoride on the outside. So I don't fit anywhere, except I'm so glad I'm at your interview today. So who knows? This is why I'm excited. Maybe somebody somewhere who really wants to put an end to some of this disease ask for more, because I can explain the science of what I suggest and why I suggest it. And that's what I try to do in layman terms.
Well, you're talking to thousands of young dentists right now. Would you have them start with reading your book on Amazon, Kiss Your Dentist Goodbye? Would that be a good start to start?
I would begin with some questions that they should ask themselves. How healthy is their own mouth? I mean, begin with yourself. I used to give talks to hygienists, and I would ask them, who here has had a filling? To which, of course, most of the room puts a hand up. Who thinks they're going to have another filling? The answer to that, if you're really a hygienist, should be zip, zero, no hands go up, right? You should know how to control disease, shouldn't you? If not, why not? I gave a talk to a keynote address to a hygiene school many years ago, and I talked to them about this whole subject and what I suggest to do to control it, which is, of course, xylitol and a specific mouth care routine. And I explained all the science. At the end of this keynote address, the dean of the 50-year-old hygiene school came up to me and said, "Oh, Ellie," she was a woman my age, "I am so glad you came today. My teeth are falling apart." That's the dean of the hygiene school. Her teeth are falling apart. I'm going to tell you, I've had one cleaning in 30 years and no treatments since I was a kid in England. I have an old adaptic filling in one of my teeth that's still there and perfectly fine.
You don't get regular cleanings?
Absolutely not. Why would I have a cleaning if my mouth is perfectly healthy? And that's my question to your young dentists. Is their mouth healthy? Do they care? I assume they care. And if they care, measure it. Find out if they really are healthy. We did this with AOSH. I was a founding member of AOSH, the American Academy for Oral Systemic Health, and put a lot of effort into it in the early years. And they had a meeting recently in Dallas. And when I arrived there, out of the blue, it turned out that they were doing bacterial mouth testing. They were doing this oral DNA testing to see if there were periodontal pathogens. They had an AOSH challenge. You know, which of our dentists here, there are 400 odd dentists doing this thing, who has the healthiest mouth? And they took this bacterial monitoring test of saliva. They had a scan, the CIMT, carotid intermedia thickness scan, to see if there was plaque in the carotid arteries. They did A1C, C-reactive protein to measure inflammatory markers in the blood. And they also took an antioxidant level measurement. So they were looking at pathogens, you know, basically they were looking at periodontal pathogens and its influence potentially on inflammatory markers and plaque in the carotid artery. Okay, all these dentists, unbelievable results. People had carotid artery ages 25 years older than they are. There were young guys with a carotid artery age of 55, and they're in their late 20s. They had people who had a 50% blockage of their carotid arteries. These are dentists and health providers. Have you ever done this test?
No, my doctor said I wasn't healthy enough to go through the test.
It would scare you.
He said you'd die during the exam.
What about your teeth? I mean, what about your mouth? Are you interested to find out if you have a periodontal pathogen, concentration that is a concern? Because these periodontal pathogens live in our mouths. It's just when they get too many in the wrong place that they become a problem. And it's a very simple test. You spit into a test tube. I mean, it's not ideal, perhaps, and people could argue that. But
which one do you like?
Well, there are different ones. I think. I mean, I have to qualify it, but I think currently a really good visual is the oral DNA test, because it's. I mean, we have 900 kinds of bacteria in our mouths. 900. We have 11 pathogens we have to worry about for periodontal disease, and a very few that become plaque and create carious situations. I'm going to say it like that because there's viruses and fungi, and it's a little more complicated than just strep mutans. But basically, there's some plaque bacteria of different kinds, and then there are 11, maybe 12 pathogens of periodontal disease that we have to worry about when their levels get too high. So take the test. How healthy is your mouth?
But how would you answer all the Irish dentists listening to you right now saying, nah, the Jameson whiskey killed all those, and all the Russian dentists saying, nah, the vodka got it?
Well, find out. Take a test. Take a test. These dentists who brush and floss and have cleanings every 3 months, they thought their mouths were healthy, or they wouldn't have even put themselves in that situation. The average score for these very interested, concerned dentists who are part of an organization that talks about oral systemic health all day long, they had a 70 out of 100 average score, except one outlier who doesn't have her teeth cleaned, has never flossed a day in my life, doesn't subscribe to all the stuff that goes on in dentistry traditionally for prevention. I'm 98 out of 100%. And I expect to win again this year. How do I do it? I'm not puffing myself up. I'm just saying, if you don't investigate thoroughly, you can't tell, because this is an invisible disease. There's no pain, there's no swelling, there's no bad taste. You just don't know until you have dementia or arthritis or gut problems, and a consequence, and I say high risk for stroke and heart attacks. So if you have the chance to reverse that, why don't you test for it? I mean, even the C-reactive and A1C test is a tiny prick in your finger. It's no big deal. I think as a patient, I would way rather have those tests done at my dental visits than routine x-rays that maybe I don't need, but the insurance pays for it, or cleaning.
Exactly.
What is cleaning for?
Ellie, what do you think is related to oral health?
Everything. Your whole body health is all connected, but it is the ecosystem of your mouth that determines health or disease. I tell patients your teeth are really like a coral reef in salivary liquids. Everything you eat, everything you drink, your own saliva, which is a consequence of your blood chemistry and liquids, dehydration, hormones, stress, everything affects that. Diet and nutrition, what you eat, how well you absorb minerals, that also affects your salivary quality. All these things end up in your mouth in a sort of peculiar way and drive the biofilm either to a state of disease or to a state of health. And what's great is you can drive the bus yourself. You don't have to simply say, oh, I'm British, I got bad teeth, there's nothing I can do. Yes, you can. You can change the conditions in your mouth, either artificially or just with changes in diet, nutrition, exercise, detox. I mean, there's a number of ways to do this, but I have found a very simple way that anybody can use without inconveniencing themselves. After every meal, every drink, everything you eat or drink, you have a tiny amount of xylitol. Now, why don't American dentists know about xylitol? It is the quickest, easiest, most effective way to change the pH of your mouth, to get rid of acidity. And we want to get rid of acidity because the acidity drives unhealthy biofilm. Now, if you don't want to do that, you can eat a piece of cheese. You can eat some nut butter on celery. I mean, we can go through things that do the same kind of stuff, but I just think it's easier to say take a pure xylitol, mint or gum, after everything you eat and drink. Boom. That's number one.
And where would you buy the xylitol at?
Online. Maybe your dentist sells it. Maybe your local health food store. You can buy a 1 pound bag of it. It's $10. And you only need a few crystals in your mouth, directly in your mouth, not dissolved in water, but directly in your mouth. Because what it does is it pulls saliva from the roof of your mouth, the palatal glands. And in most people, unless you're horrendously mineral deficient, that will be mineralized saliva, which then douses your mouth in liquids that get rid of the acids, push the biofilm towards health, and at the same time, the minerals rebuild the strength of your teeth. And your tooth enamel is really a helmet over what's underneath. So if you keep that helmet healthy and strong, not much else is going to happen underneath. But see, I think the problem with all of this is the energy level to explain this to patients is missing because there's no money in it. People have said to me, Ellie, why would I do that? And when I start seeing if I've got a healthy mouth, I don't want a cleaning. I don't want you to weaken the enamel by perhaps abrasive cleaning on somebody's mouth that doesn't need it. If their biofilm is healthy and they have no plaque and no calculus, don't clean their teeth. How are you going to tell a patient that? And what money are you going to make? I mean, the system
it's sad. It's sad because if you take a dental office, you take the rent, mortgage, equipment, build out computers, insurance, and you divide it by the average dental office. And then you work in all the cost of, the front office, all the cost. They come into the hygienist for an hour and the insurance is only going to give you maybe $80, $90. But if they come into my room for an hour for a root canal, they'll give me $600 to $800. If it's for a crown, they'll give me $600 to $800. I mean, they go into hospitals. They'll give you $100,000 for a bypass and $25 for an exam.
I know.
How can I sit there and talk to my patient when the owner of the hospital or the director is saying, dude, if we don't do 3 bypasses a day or 3 major surgeries, we're out of business. So you have to drill, fill, and bill to pay the light bill. And it's the incentives are so wrong.
And the sad thing is that in our society, there are always going to be people who don't care about their teeth. Tons of them, enough to fill every dental office. The people who just don't care. I mean, I have a brother. I hope he doesn't watch this video. I'm sure he never will. But he doesn't care. He doesn't care about his health. If he's overweight, he has a heart problem. He goes to the doctor. He gives him a pill, statin, whatever. He doesn't want to do the work of exercise, diet, nutrition, so on. And the same with his mouth. He doesn't care what his teeth are like. I can help him. Of course I can help him. I can send him a monthly supply of what he needs, but he wouldn't use it. So I can't help him. I really wish I could, but I can't. I want him to go to a dentist and let that dentist make money keeping him as healthy as possible. And that's what dentistry is so good at. Don't get me wrong. Dentistry is so good at helping people who don't want to have a thing to do with it themselves. Just like doctors. They got a pill for this and they can adjust it and monitor you. But if you want to be healthy, you look after yourself, right? You figure out what you're going to eat. You figure out how much you're going to exercise. High intensity, long distance, weights, what's going to work for you, personalized, you as a person. And I think dentistry is going to have a very big wake-up call really soon because I think personalized oral health monitoring is coming. So on your iPhone, I mean, look at the iPhone and the tablets now. You can take your blood pressure, you can take your heart rate, you can monitor your body mass index, you can do all this stuff with help from devices, apps on devices. And I believe within the next 5 years, you're going to be able to do your own periodontal pathogen test on your iPhone. A cartridge attached to your iPhone, spit into that, and it will do some humming and whirring around and tell you whether you have to worry about your periodontal pathogens. Dentists are going to be nixed out of the equation if they're not careful, because they don't want to be a part of this conversation, very many of them. And the world that cares, the ones that actually visit the dentist are going to move on because they don't want to be kept as money-making. I want to choose an animal that's not too, what are your patients? Just a money-making, that's not, I don't know, whatever. I can't think of a horse in your operatory that you have to do work on in order to pay your bills. I don't want to be that person. Do you?
I mean, it's sad, but I mean, you can talk to physicians in Phoenix, Arizona, and when you say, I want to talk to a cardiologist, their first reaction is fear, because they know if they send an old man to a certain cardiologist, almost every referral is a $100,000 quadruple bypass. And they're but I want to ask you another question. It's interesting. You're one of those rare unicorns who have practiced dentistry in 3 different countries: Switzerland, United Kingdom, America. everybody that's listening to you will probably only spend their whole life. You're talking to dentists in 150 countries right now. Most everyone, I think only 1% of the planet today lives outside of a country they were born in. So what did you learn anything from practicing in 3 different countries?
Oh,
Is dentistry all the same? Are the
oh
people the
no.
same? The patients the same?
This is why, I mean, again, I am definitely not smarter than anybody else. I think I see things really differently, mainly because of that. I became a dentist pretty clueless. I mean, I had this scientific background that I had to have because when I was a dentist, women were not in dentistry. They didn't think we were capable. And when we got married, we'd give up dentistry because we'd have kids. I think I've worked every single day since the day I graduated, and most of my peers are now old men retired on the beach in Spain somewhere. But no, being in England, I learned to extract teeth, and the bigger the filling, because the more we got paid, everybody had very big fillings with extension for prevention. Do you remember that era? And I was disgusted by the whole thing. You get paid for what dentists get paid to do. I went to Switzerland where the insurance systems encouraged dentists to prevention, and the bigger the filling, the larger your co-payment became. So you, the public, you, the patient, is going to be motivated by money to go for regular preventive education and experiences that will save your filling from getting bigger. And root canals were actually less expensive than an extraction. So people had root canals and crowns before they would have a tooth out. So dentures, I don't even recall if I ever saw a denture in Switzerland. Certainly, compared with England, 1970, and it's the same, same era, but 2 entirely different countries motivated by money. So when I came to America, I was really confused. Nobody seemed to understand disease at all. They did the most incredible restorations. I mean, I had to go back. I took a GD course at the University of Rochester, unnecessarily, extra, because I just didn't know how to do that sort of restoration work. Your restorations, your being able to make bad teeth look great with fake replacement parts is America's forte. That's why everybody thinks they got nice teeth. Majority of dentists have crowns and veneers, and what's the health of the mouth? It's not connected because the teeth look so good, you assume they're good. And that's where everybody's been confused by the facade of healthy teeth. How many of those politicians with their white, shiny rows have a healthy mouth? I'm sure their breath is disgusting and their periodontal pathogens probably coming out their ears because they're under stress, they're eating poorly, they're running around, they're traveling. You put a toothbrush in a bag while you travel, the periodontal pathogens will grow and multiply in that bag. You've got to disinfect your toothbrush every day. Picks up all the bacteria in your mouth, one single use. Does anybody know this stuff? No.
But don't you think with the politicians, as the lies are flying out of their mouth, it kills the germs that cause disease?
I think they'd be much healthier, happier people if they had healthy mouths and less stress and less of these other ailments. And it's so sad to me that people who care, if they don't care, like my brother, and maybe many of them don't because their focus is elsewhere. Dentistry is fine. I don't have any argument. My argument is if I am a patient and I want to know what can I do to make my mouth healthier, because I don't want to keep doing this, regular cleanings. And for women, it's our hormonal changes as we get older, get drier mouth, get more, mouth acidity is the key factor in women's bad oral health. For 9 months when you're pregnant, your mouth is acidic. It turns acidic the day you're pregnant till the day you give birth. You've got to have something to help you through those 9 months, or of course your teeth are going to start deteriorating. And help is not flossing. Again, I'd love to talk about flossing for a second.
Well, I thought the best thing about the recent media blitz on there's no evidence to support flossing was, like most media, it starts a conversation. And
Exactly.
if anything, it got the whole Facebook universe to start talking about flossing. But the they seem to be quite sure that there was no evidence to support flossing.
And
What are your thoughts?
I've said that for 30 years. And in 2012, a British reporter called me up because she was writing an article in the London Times about floss, funnily enough. And she thought I would be the American flossing queen because I had this book, Kiss Your Dentist Goodbye. So obviously I was the flossing expert. And I said to her, there's no science for flossing. I've never flossed a day in my life. I use this sequence of mouth rinses and xylitol to loosen plaque, wash it away. You don't need to floss maybe except to get food out of teeth. But for dental health, there are far better ways to improve your gum health, and it's diet, nutrition, this ecosystem that we talked about. So anyway, I sent her off with all that she needs she goes to the dentist in England, asks what happens if I stop flossing. They give her the usual story of stalactites and stalagmites and stuff growing out and what's going to happen to her. And she goes away, uses what I recommend, doesn't say anything, goes back for the next visit, sits in the chair, and the dentist goes, wow, your teeth have never looked so good. What are you doing? So she writes this in the New York Times, in the London Times, this article. Her name was Helen Rumbelow. And again, a firestorm erupted everywhere. In Canada, I had the BBC World Service calling me. I had this dentist in England arguing with me, Nigel Potts, I think his name was.
Oh, yeah, I know Nigel.
He and I had this PBS interview, transatlantic interview about flossing. And, and he agreed with me. There's no science. Yes, it's a bacterial disease, and just moving the stuff around with a length of string doesn't change the flora of your mouth, the environment. But you see, at the end, he can't stand it. If you listen to the interview, the last thing he said, but you gotta floss, because these people are entrenched in their mindset. And that's what I saw when this happened recently. I'm high-fiving friends of mine when the AP News reports this stuff about flossing. But then, of course, the ADA come along with lies.
Well, it's the human condition. Like my two oldest sisters, they went straight into the Catholic nunnery after graduating from high school. I mean, straight to nunnery. I've been a dentist for 29 years. My oldest sister's been a nun for, I think, 35 years. Do you think I could write a book that she could read and become Buddhist?
Mm-mm.
Or Hindu?
Oh, no.
I mean, the human condition is such that, people, I'm at my age, I'm of the opinion that 80% of people start with what they want to believe and then work backwards.
Yeah.
And about 20% sit there and say, okay, what do we actually know? You're born into so much of your thoughts. I want to go back to this ecosystem because I've been reading a lot of interesting research from outside the United States for my whole life. Like, the Americans used to always cut out the ulcers. But it was an Australian doctor who said, well, what are you cutting out? Is something wrong with the ecosystem? It's an ulcer. And then she was the one who discovered it was H. pylori bacteria and antibiotics.
And again, to interject, and I apologize for crashing in, but if you're interested in that subject, you have to read a book called Missing Microbes by Martin Blaser. And that will tell you that we've been wiping out H. pylori because of all these ulcers that everybody, including children, have. I mean, the amount of medication given for acid reflux is astronomical when you start researching it. And what he's saying, along with the overprescription of antibiotics, which dentists, again, very much in the thick of this, they're prescribing way too many antibiotics for various reasons. And we're wiping out the bacteria that actually satiate us, that stop us from feeling hungry, that help us to control our appetite. And this book by Martin Blaser is a fascinating read. He's been decried by some of the medical profession, but I think he's right on the target there, actually, because I think there are a number of factors, but I think what he's saying may be one of them, that we're adjusting the flora. Yes, bacteria are responsible. It wasn't an ulcer like some mechanical thing. But again, we have to be careful in our adjustment, because adjusting it, we can go the wrong way. And I think that's the same in the mouth. You see periodontal pathogens, everybody wants to use an antibiotic.
But you know what?
I,
Another thing I'll never be able to get out of my mind, because I was born and raised in Kansas, and a third of the kids in my class always came from dairy farms, cattle farms, horse. There's 7.5 billion people. There's 1 billion cattle, 1 billion pigs, 1 billion sheep, and 25 billion chicken. And being a little boy, I remember them mixing the antibiotics with the feed.
yep.
And asking, I wasn't even as tall as this table, asking that big old guy in the overalls, why you do that? He goes, well, you feed them antibiotics, they get fat.
Yep.
And then you look at the prescription antibiotics around the world, and they always want to point to like high fructose corn syrup or something like that. It's like, dude, how come everybody in cattle, sheep, and pig knows this will make them morbidly obese?
Well,
And then the humans say, oh, well, is it because we're not? Is it because we're not animals? We're made in God's image, and we're a spirit, and they're cows and sheep and pigs.
I mean, I so agree with you. And it's the same thing when it comes to like the low fat craze. You ask a pig farmer, they knew decades ago that if you feed pigs skim milk, there are more sugars than fats. The pig never gets satiated, so the pig goes on eating and eating and eating until they are the fattest pigs in town, which is great if you want to sell the bacon. But why did they let humans get into that same tract, eating low-fat diets, thinking that, I mean, it sounds like it should be healthy, but it's not. My kids were teenagers when I wouldn't let them drink skim milk. They're like, Mom, what do you mean fat is fat? And it's like, thin it down with water, but keep the percentages of fat, because that's how we live.
And those farmers were doing they invented artificial insemination. They were doing, because their cattle were so obese. I mean, I remember seeing this when I was a little boy. My boy's grandfather, you know how he died? When the bull would be smelling around a female, if he would mount her, they're too obese, so it wouldn't work. So they pull her into a pen, and then the obese guy around it. But a lot of times someone had to reach underneath there and help guide it in. That's how morbidly obese. And the bull slipped off the cow in heat and crushed Grandpa, and he bled to death. And you sit there and these farmers for half a century, you could never convince them that antibiotics in the feed isn't the best thing to make them so morbidly obese that they can't even reproduce on their own. And then you take your kid to the pediatrician, and he just writes a prescription.
Prescriptions first thing, yeah. And here I would like to, this is back to the ecosystem. It's the same in the mouth. We're about to do the same thing with our philosophy. I'm a pediatric specialist. I have a pediatric specialty. And the AAPD's big goal now is to put sealants on every child's tooth. Now, most dentists, and probably you, think, okay, that sounds like a good idea. We're stopping the molars from the first place that usually decays in a child's mouth, right, is a first permanent molar as it erupts. So let's seal up the grooves. I did it to a lot of patients at one point, and even to one of my children. But then I started learning more. Why do we do that? What bacteria are supposed to live in that groove? Because believe it or not, nature didn't mess up. What happens is baby teeth become infected, as I'm sure you know, from the mother's saliva. And whatever bacteria are in the mother's saliva actually infect or colonize, depending whether they're bad or good, the first baby teeth to come in, say these little first incisors that pop up when the kid's about 6 months old. And then whatever's on those teeth will obviously infect or colonize the remaining baby molars as they erupt. And the baby molar grooves are very important, because whatever gets in the grooves of teeth, we've known this since the 1980s, the first bacteria in molar grooves dominate the mouth. That's the foothold. That's the Grand Canyon. That's the place they can hide and dominate the bacterial flora from. So baby molars that erupt in the first year of a baby's life are very important, and you want to persuade good bacteria to live in a child's mouth with decent nutrition and different things. Xylitol, wiping teeth with xylitol, happens to be a fabulous way to encourage healthy bacteria and discourage, by making them slippery, the bad guys. So we as dentists have known that children, by the time they get to the age of 4, which is a mouthful of baby teeth. That's a really important stage. Children with healthy teeth at age 4 go on to be healthy. Children with unhealthy teeth at age 4 often live their entire lives with bad teeth. How does that happen? The bacteria from the baby teeth colonize or infect the erupting first permanent molars, get into these molar grooves. Now, we can assume everybody has bad teeth and everybody doesn't care. So let's seal up these grooves. Okay, you've stopped them there, but where are those bad bacteria going to be? They're just going to be floating around until they find the next place to attack. And we can talk about that in a second. If those grooves were colonized by healthy bacteria would get into those grooves at that child's 5 years old and then dominate that child's mouth for the rest of their lives. So what kind of bacteria go in those grooves? Oh, the bacteria that break down gluten and carbohydrate. So is putting a sealant, which is a BPA-containing plastic, in the mouth of a child, number one, that's a problematic thing. Number two, are we shutting out the very place that bacteria would live? Because when you're grinding up your food, they're in the crevices. They're exactly where they need to be to break down gluten and help you break down carbohydrates. I'd like to see a study whether the children with sealants end up with more gluten intolerance, and are they more obese? I don't know. I don't have access to those studies.
Well, it's because they believe that there's that one of the bugs is a bad guy, and you got to kill the bad guy. They don't understand the natural balance. Like take the United States. You got rid of all the top predator bears and wolves. So in the United States, there's over 1.2 million cars a year hit deer and rack up $4 billion of auto insurance because there's no top predator. They don't realize that these things live. There's got to be some
The whole thing is balance. The whole thing is encouraging. It's not killing. Again, dentistry is on this mission. Fluoride treatments are 11,000 times stronger. This gel we put on children's teeth than we want. You want very dilute fluoride to help stimulate remineralization. You don't want to kill every bacteria in the child's mouth. There's no studies to show why we're doing it, and yet we do it. Sealants, again, I think we have to look very closely at whether they're helpful or harmful. Why do we clean a healthy child's mouth? Tell me why your hygienist picks up her stuff and interrupts the healthy balance that might be in a healthy child's mouth. I don't want you to touch my grandchildren's mouth if they're healthy, which they are, of course, but why would I let you get your stuff and start scraping everything that's already healthy in their mouth off their teeth? Makes no sense.
And once again, the Australians are leading the way. I mean, not only did they lead the way on changing the Americans' view of ulcers and changing it from a surgery to understanding, they're pioneered fecal transplants.
Yeah.
And listening to that lady talk, she was realizing these kids after chemo for leukemia or whatever, they were so sick, and when they pooped, their anus was so raw. And finally, it dawned on her they've killed all the good bacteria in the gut. So she had her mother poop in a jar and gave the kid an enema, and she says, in quote, 24 hours, the kid bounced back.
Yeah. Oh, there are lots of stories of that, and it's not savory to talk about, but honestly, the mouth is the same thing. If you clean, in 1970, they did these studies with xylitol, where they gave xylitol chewing gum to women with horrendous teeth, and they gave it to them in the last trimester of pregnancy and until their babies were a year old. So what did they do? They cleaned up these mothers' mouths, because xylitol is the key for changing the oral biofilm naturally. It makes plaque slippery, so it washes away. It encourages healthy biofilm to take its place. So they did this with xylitol. Then, at the end, when the children were a year old, they took away all the xylitol, but they continued to go back and monitor the children born of the mothers that had cleaned their mouths. And what really happened with these mothers were then transferring to their babies, talk about fecal transplants, this is an oral transplant. The healthy bacteria colonized this baby's mouth. And from there on, even into adulthood, these children, actually at 6 years old, the children born of the mothers who had had that treatment, so their mouths were clean, had 85% less caries than the rest of the population. And yet you can't talk about, you're not really allowed to talk about that study in dentistry. I can't get a place at the AAPD to explain that to the pediatric dentists because they don't want to hear it. In fact, I was trying to get to speak in Arizona because you guys are pretty progressive over there in the Southwest. And I think I talked about not having cleanings, not doing sealants, and all of a sudden I got dropped off the list of potential speakers because I think it's just too uncomfortable for dentistry right now.
Well, then you know what? You should make us an online CE course. The millennials don't understand when you sit down in a chair and read a boring book. They want to see like YouTube and they want to see animation, and they don't understand why you would fly to another city and go to stay in a hotel and a convention. But we put up 350 hour-long courses on Dental Town. They're coming up on 700,000 views from every country on earth because they just would rather watch it on their iPhone or their iPad than go to the convention. So that'll reach a lot of people. So I want to go back to some of the basics. So what do you think about water fluoridation?
I think that it is a very dishonest subject. Here in Austin, for example, I actually last summer was part of a vote. They had a vote at the local city council on fluoridating Austin's water supply, which has a 0.04 naturally occurring fluoride content. Naturally occurring. And they want to add more. I don't know why, because people drink a lot of water here, like where you are. It's hot, really hot, and there's a lot of people drinking a lot of water. So why aren't we satisfied with 0.04? The universal number is 1, but why? If you're in a place where you're drinking 5 times more water than upstate New York, it shouldn't be the same. We have to look at the community. And we've got this beautiful naturally occurring alkaline water here in Austin. Why are they messing with it? And I was definitely on the side of voting not to add it to the water supplies. Because 2 things. 1, fluoride doesn't prevent the bacteria that cause disease. They're not, they're again, it's a reactive form of prevention. Fluoride helps stimulate remineralization after you've got a cavity or after you've had damage. It doesn't change the ecosystem to prevent damage. It's a Band-Aid. And it doesn't really work better by drinking it than it does for rinsing with it. So if you're going to add toxic stuff, because the fluoride they add to our water is not sodium fluoride, it's a silico-aluminum compound, then I don't want to drink that. I would rather rinse with a sodium fluoride product like ACT or something like that, and then I can spit it out. I'm not consuming it. I think fluoride's a lot like, fluoride is like chloride. We don't want to breathe it, we don't want to drink it, but every day if you don't have a tiny bit of sodium chloride, which is table salt, you're going to die. And your teeth, if they've had a filling and you don't rinse with fluoride, they're going to crack. But just because a tiny amount of salt is good for us, Kentucky Fried Chicken that probably only has a tablespoon is not good for us. The amount between good and not good is really small. It's a small window. And this is not understood by dentists. They think that if a little is good, more is better. I would never recommend the strong gels. I would never recommend it. It's constant care with a small amount is good. But again, why do we mess with Austin's water supply? I didn't understand it. And then I took the person who was involved in this out for lunch after they voted it in. I mean, they put up some very inaccurate science, pictures of early childhood caries, and said, if you don't put water, fluoride in the Austin water, this is what's going to happen, which is not true. And when we had lunch, I said to him, don't you worry about women's thyroids? Because I think fluoride in the water potentially damages the thyroid tissue of women. Not everybody, but women in particular, young girls. Because I gave fluoride to my daughters. My 2 older daughters have fluorosis and damaged thyroids. I did not give it to my younger daughters. Their whole reproductive things are different, older daughters and younger daughters. And when I talk to this guy, he tells me, this is the guy that supported fluoridation in Austin. He doesn't give it to his child. Well, I have a problem with that. Let's get dentists out of this equation. They don't know enough, and they don't have the science, you know, to be involved in those decisions. We need a really scientific chemist to look at water supplies. So am I in favor of fluoridation? Actually, no, because I think the wrong people are in charge. Just like the government money deficit, I mean, we're going in the wrong direction. We need new eyes on our fiscal system if we don't want to keep adding to our deficit. In dentistry, we're not getting healthier generations of healthier teeth. We're getting more people with thyroid troubles, and potentially linked to this, it needs to be reevaluated. But I do believe
I think that's the reason Trump didn't just win the White House. He won the Congress, the Senate, the Supreme Court, the presidency. I just think watching people the last 20 years like a businessman, I mean, the government's had about an 11% approval rating for 2 decades.
yeah,
I mean, imagine if Kentucky Fried Chicken only had 11% approval rating from their
it would be in
customers.
business.
By the way, that Kentucky Fried Chicken, all those 11 ingredients are secret. No one knows what they are, but I'm willing to bet one of them sold.
I'm willing to bet.
I want to change to a totally different subject. Oral cancer, huge. When we were little and got out of school, they didn't know about this HPV. What do you think of oral cancer and the HPV vaccine? Do you think dentists should be vaccinating their patients so that they don't get oral cancer?
On this one, I really don't know. I think that if we're really worried about oral cancer, I have been saying for 30 years that most of the oral care products, and again, the way we treat teeth and the mouth ecology with such carelessness, is one of the problems that perhaps opens us up for more oral cancer. So I'm not saying whether they should or shouldn't get involved in the preventive treatments. I certainly think they should be involved in diagnosis. But why? Again, it's no good just picking up caries. Why has somebody got tooth decay? Why has somebody got periodontal disease? Why has the amount of decay, cancer increased so much? And when I wrote my book, which actually I was writing it probably over 20 years ago, I warned that the risk of cancer was going to increase because people were using peroxides and whitening products and rinses that look good but are not safe. And we know they're not safe, and yet nobody's saying this. I contacted the chairman of the scientific committee about this very fact. Why don't they alert people to the dangers of whitening products? And basically they told me there's too much money in it. It's like everything. It's all about the almighty money behind the throne. And the public has to figure this out for themselves. So there are lots of toothpaste that dentists hand out in their offices I don't think are safe, and you can't analyze them because the industry has got such a blanket presence in America. These toothpaste are banned in Europe. You wouldn't put triclosan in a mouth in Europe. Nobody.
Yeah, America is. I've lectured to dentists in 50 countries. I mean, this last year I was in 4 continents, and Americans. It's funny when Americans think it's all about truth, liberty, justice, but America is the most. Money's the answer. What's the question? It just rules the day. This is totally off topic, and I'm just going out on a limb here. Asking you a wild question not related to what you agreed to talk about. But 1 in 68 U.S. children has an autism spectrum disorder, a 30% increase from 1 in 88 just a few years back. Do you have any, and everybody, there's so many people telling you what doesn't cause it. But when you talk to those people, you say, okay, well, you know what doesn't cause it. Well, what caused it? And they say, oh, I have no idea. It's like, oh, so your mind is shut to what anyone else is saying naturally or holistically, but you have no idea what caused it. Do you have any thoughts on autism?
Yes, I absolutely do, because I think, back to where we spoke at the beginning about Weston Price. He took a really close look at civilizations that were doing things very naturally, breastfeeding, eating natural foods. They didn't have all these problems. In the same way, there was a lot of research that they did by the Pottinger Institute, which was to feed really bad food to cats. I don't know if you've heard about that whole thing. And generation after generation, the health of these cats and everything about them just became more and more mangy and awful as the generations continued to eat poorly. I believe, again, everything goes back to our microbiome. Our bodies are all bacteria. I mean, we think we're us, but we're actually just a few cells and tons of bacteria. Well, not tons, but pounds of bacteria. And looking after those bacteria in a sane way. And I don't know, are cell phones a problem, or the things in carpets, the environment, lead. I mean, there's so many things to be fearful of. And again, fear itself. Fear makes you acidic. Fear makes your body not function well. So we don't want to be so fearful. But at the same time, we have to take a very calm look at how do we help children have a good start in life with the best possible microbiome in their mouths and in their gut. I mean, that's obviously, as a small baby, what it's all about. You're a tube with skin on the outside. And we know that the health of the mother's mouth, the mother's oral health, has a direct impact on her baby's microbiome, gut microbiome, when the baby's born. So again, I take, is it the chicken or the egg? I think we have to begin somewhere. And I'd like to begin with young, pregnant women's mouths and get them healthy, just like they did in 1970.
You know what's funny, what you just said, though, is I was talking to the dental director of the United Concordia, and, money's the answer. What's the question? The most expensive thing to a health insurance company is when a woman drops a 1-pound baby and it's going to be in the hospital. And one of the lowest hanging fruits they've noticed is that they had gingivitis and periodontal. So they're already starting to look at the cost of, well, what if everybody that's pregnant was put on a 3-month recall, paid 100%?
No, you see, again, we're attacking it it's like throwing the antibiotic at the problem. The problem is not routine cleanings. The problem is, it's an imbalance. We're just going, the mouth is like a garden. You get the blowtorch and you torch the garden. Well, great. It's clean, but it's not healthy. 3-month cleanings are not the answer. I beg them to, if you've got an in with these guys, look at the idea of changing and balancing the ecosystem by keeping the mouth more alkaline, by educating these parents in very simple things that will help the ecosystem be stronger. And
you make an online CE course on Dental Town. I'll make sure every one of those CEs. No, they will. You know what? You know why they love the online CE? All these big corporate chains and dental insurance companies is because it's so much less expensive than flying to a convention, staying in a hotel.
Well,
I mean, just the cab fare from the airport to the convention center is 5 times more than watching something online. Man, you're just, I could talk to you for 40 days and 40 nights.
Well, good job didn't come to Austin then.
Yeah, I would love to go to Austin. I would absolutely I love Austin. Texas is that's a big and changing state. Oh, I want to ask you another off topic. You said you're trying everything. Another billionaire politician, Mayor Bloomberg, was not happy that his soda tax got crushed in New York. And he got out his wallet and he got a soda tax passed in 3 cities in California. I believe they were Oakland and 3 other places. And he's a firm believer that that one of the problems is that Mountain Dew costs less than a gallon of milk. Moms will tell you that milk will go bad in the refrigerator after 2 or 3 days. Mountain Dew will stay good probably for, a year. And I would agree to take the fluoride out of all the water if we could put it all in Mountain Dew. We just go from water fluoridation to fluoridated Mountain Dew. But what do you think of Mayor Bloomberg's sugar tax that was on soda tax? He because most economists will tell you, because we got lots of data that every time cigarettes get more and more expensive, young kids smoke less and less, because in their walnut brain they're like, okay, well, if a pack of cigarettes and a Big Mac costs the same, I'll go either way. But if a pack of cigarettes cost 3 Big Macs, they're like, I'm going to go eat, I'm going to buy something else. A lot of economists believe that if soda cost more money, that Americans would consume it less. And that's another problem where food cost and your disposable income in 2016 is 10% of your disposable income, whereas in 1950 it was 30% of your disposable income. So as food has become mass manufactured and cheap, people just have the money to just eat bad stuff all day long.
Yeah. Well, and that's where, let's get educated people who should be caring healthy first. Let's figure it out for ourselves. Again, I go back to this test that was done on educated, very high level oral systemic dentists, and their mouths were not healthy. They were still having problems. Let's get them healthy. Let's at least some of us agree on how do we do this. My personal belief is it's very hard to stop people having bad habits. I don't do that. I was married to a restaurateur. My background was as a wife of a restaurateur. I'm a dentist. We had 70 waiters with bad teeth. And the waiters had a soda machine. There was a soda fountain. They didn't have to pay anything for it. They had a soda fountain. They were all day. They had a coffee machine. We had a bakery with broken cookies put out on a shelf all day. I'm looking at these kids. They were smoking back then. They were drinking at night. They were falling into bed without cleaning their teeth. I had a population of the worst possible waiters from a point of view of oral health. One guy, he wanted white teeth. He cleaned his teeth with Comet Cleaner. That was his idea of a good toothbrush paste for cleaning his teeth, the stuff used for Ajax, for cleaning the sink. So his teeth were totally demineralized. The rest of them were having these horrible habits. So I had this small community that I cared about. What did I do? That's how my Xylitol business started. The best thing you can do for people with bad teeth is help them after everything they eat and drink, even if it's soda, get rid of that mouth acidity and alkalize the mouth. You can drink soda as part of a meal. From a dental perspective, I'm not suggesting soda is good for you. But I don't like Splenda. I don't like aspartame. I don't like anything like that. So I'd get all of that out of the way at the same time as the soda. But I can't do that. We can't change and control people, but we can tell them, eat what you eat and eat it at a mealtime, and then have some xylitol immediately afterwards, because that's going to get rid of the damage. That's the morning after pill. That's ending the problem right there, so that you have another chance at your teeth. And teeth are like a bank account. The more you mineralize them versus the more you demineralize them, how much money you pull out of your account, how much do you put in? We're just helping people put a bit more money in their mineral tooth account. And I don't think you can stop them from all the things. I mean, lemonade, coffee, everything is demineralizing to teeth. So is soda bad? Yeah, but so I think are sealants, so are antibiotics. We're not going to be able to control everything for obesity and diabetes. But we can help people learn tricks. And I believe mouth health has a tremendous amount to do with body health. And if we can get people's mouths healthy, they may not want to eat and drink as much garbage. One very interesting thing I heard was that one of these periodontal pathogens makes a toxin that dissolves in water. And I can't say that with an American accent even yet. But it dissolves in water to create a taste that is unpleasant. So that's one of the reasons people drink soda, is because they don't like the taste of bland water, because they've already got periodontal disease in their mouth. I have taken those people, made their mouths healthy, reintroduced them to water, and they're fine. I actually probably could do a course in stopping soda addiction.
You know what I want you to do? You know what your homework is today? Go buy a slice of American processed cheese and paper and the styrofoam paper plate, not the paper plate, but the plastic paper plates, and take a lighter to both of them.
Oh, I could.
Both of them won't catch fire. They both absolutely burn and char exactly the same way. The styrofoam paper plate and the processed American slice of cheese.
Yep.
And it just you can just tell they're made out of the same thing. I mean, anybody anybody in a freshman 101 chemistry lab would say these are the same thing. Hey, we went way over our 1 hour. We're already you went 10 minutes over. Your website is drellie.com, DRELLIE.com. You guys got to go there. What are they going to find on your website?
Well, I'm working on it to change it more into a blog style website. But basically, the system that I recommend people use, contact information if they want to get in touch with me, my belief in xylitol, and it's not based on, honestly, I am in the xylitol business, that's my disclaimer, but it's because it is so amazing for oral health that I got into this business, and I felt there was nobody really knowledgeable behind the products initially. I mean, we're talking about 20 years ago in America. And, xylitol is a public health measure in Finland. It has been for 50 years. They hand it out in preschool. I mean, nobody's...
Yeah, but those are evil socialists. We can't live. I mean, what are you going to do next? Tell us to listen to communists?
The U.S. military use xylitol.
I know. And by the
it.
way, I want to say something about you selling something. When I started Dental Town in 1998, it's very funny. At the very beginning of the program, you said when the internet started, about 2000, maybe a little bit before. I started Dental Town in 98. Facebook was 2004, and it was the biggest mistake starting in 98 because dentists didn't get on the internet till about 2000. And if you look at all the ton of money it lost, I should have started it at 2002.
Yep.
And when I started it, the dentists got all mad because people who sold things to dentists were getting on the website, and they didn't want anybody selling anything. And I would just sit there and say two things. Number one, what are you, a volunteer? What do you do? Fillings, crowns, root canals, sealants? You do all that stuff for free? Oh, but the guy selling you a root canal burr or a handpiece or a chair, oh, they're evil because they're selling something, but you're a saint because you're a dentist. And I just told them, I stood my ground. The orthodontists on Ortho Town, they wouldn't stand their ground. They made it orthodontists only. But on Dental Town, I told these guys that if we're all saying, this product's red and we all wished it was blue, well, who needs to see that more than anybody else on earth is the guy making the blue chair. You know what I mean? So I want the dental manufacturers, I want anybody who works in oral health full time. I don't care what you are. I don't care if you're a dentist, hygienist, make glues, guns, xylitol. And you should be proud that you sell xylitol. You shouldn't, you should just say, yeah, I'm in the xylitol business and I'm damn proud of it.
I went through that schizophrenic phase. I had my first domain name was cleanwhiteteeth.com. That's because I was one of the first people on the internet trying to educate people. But I felt awkward, selling the product. And, I've been through this. I'm like you, I'm over it now because we're all in business to try and stay in business. And I know darn well I could earn doing fillings a lot more easily than trying to go against the grain. But
I remember when the app came out, it was so funny. This little girl in dental school, I think she was she had just graduated. It was 2008. She said she got on Dental Town and she says, I can't believe it. I downloaded the Dental Town app and it has a banner ad on it. And everybody's like, so Howard's got 50 employees. What are they, volunteers? And you work at a dental office. Are you a volunteer? You downloaded the app for free. You're reading 250,000 dentists talking for free. And your first dental thought was, oh my God, commerce, trade, money. It's not money, it's the intention. But so drellie.com. Ellie, I'm your biggest fan. I always love reading your posts. You've been posting for a long time. I think you're just amazing. I want everybody to hear you. Thank you so much for being on my show. I do hope you make an online CE course someday.
I will. I will certainly put on my list to do. I'm just finishing my second book, my last book.
When you get done with your book, email me all the details because I can put that book in front of them. I'm digitally connected to 1 million dentists around the world. So when you get done, send me a JPEG of that.
Done. I'm going to be finished writing my bit and going to the editor in beginning of December. So I'm working really hard on that right now. So
can I tell you my one book nightmare?
No.
Ryan, I don't know if you remember. Do you remember my book nightmare? I think you were too little. So it was I don't know. I think it was my second book. I'd written The Business of Dentistry. I think that was I forgot. Yeah. It was like 1990, and and it sold the whole print. Back then we only made one print. It was 10,000 books, sold them all. And then a couple years later, I wrote the second book, and it was the laptops had just come out, and I had this laptop, and I was writing the whole book for months and months and months. And we were in the front room, and I got 4 boys running around, and I went to the bathroom, and I came back, and the screen was blue, and it was gone. And I took it to this company called Datadocs, and they just said, "Dude, there's no file." I had written like, I mean, it was like the book was done. I was on the second or third rewrite, and it was, oh my God.
I actually understand that, because that Kiss Your Dentist Goodbye took me 10 years, mainly because of things like that happening, where I wrote it and then boom, it was gone. It was on, terrible things, terrible things.
I was literally depressed for like 3 days. I mean, I couldn't even breathe.
Emotionally
sleepy.
connect on that, because I went through, but I carried on to get it done because I had to. But I understand those were the eras. It's so good now. You do something peculiar and it flickers, but then it comes back with a retrieved file, which is, people have no idea what that means.
Yeah, now I think they have autosave. Now what I want Apple to do is, they say it's a smartphone. Google says they're so smart, but they can't see the email in my inboxes from a Nigerian prince. They can find a Mexican restaurant in a town of 2,000 in 0.01 seconds, but my inbox, they can't figure out that I'm probably really not going to get transferred $1 million. And what I want Apple to, their next update, is when someone sends you a text and you reply, but your big monkey thumb doesn't hit it right, and the other person's like, "Are you there? Are you there?" It should automatically send the damn text. But on that note, Ellie, thank you so much for coming on my show today.
Thank you. Appreciate you chatting today.